All right, welcome back to the deep dive. Today, we're going deep on a topic, well, I guess you could say every safety pro knows and loves, right?
Yeah, for sure.
OSHA's general recording criteria.
Definitely.
So we're going to look at what gets logged on your OSHA 300s. We got some official OSHA documentation here and a really cool training video from Safety One Source.
Awesome.
So let's break this down, see what's important. First things first, can you just give us the big picture? Like, what are the major things OSHA wants us to track?
Well, OSHA has a specific set of criteria that determines whether an injury or illness is recordable.
Oh.
We're talking about things like, death.
Right.
Days away from work, restricted work or job transfer,
Sure.
medical treatment beyond first aid,
Okay.
loss of consciousness, and significant injuries or illnesses diagnosed by a physician or other licensed healthcare professional.
Okay, so anything serious enough to cause, like, time off, long-term problems.
Right.
Gotcha. You mentioned significant injuries, though. Like, what makes something automatically significant in OSHA's eyes?
So there are certain conditions that OSHA considers significant regardless of whether they result in time off or, really extensive treatment.
Right.
These include cancer, chronic irreversible diseases, fractured or cracked bones, and punctured eardrums.
Wow.
As soon as a healthcare professional diagnoses one of these conditions, it's automatically recordable.
So even a fractured toe that doesn't cause any lost time, still got to log it.
That's right. Even, seemingly minor fractures are considered significant injuries, and they must be recorded on the OSHA 300 log.
Okay. Things are already more complex than I thought. Let's dive a little deeper on one of those categories.
Okay.
Days away from work seems pretty straightforward, but I'm guessing there's some details safety professionals need to be aware of.
You're right. Days away might seem, simple on the surface, but there can be some tricky situations, especially when it comes to weekends, holidays, and even pre-planned time off.
What's the catch with those?
Well, the key is that OSHA counts calendar days, not just work days.
Oh, okay.
So if an employee is injured on a Friday
Right.
and wouldn't have been scheduled to work Saturday and Sunday, those weekend days still count toward their total days away from work.
So even if they weren't planning to work those days, they still count because they couldn't work those days.
Exactly.
Gotcha. What if a doctor recommends time off, but the employee, they come in anyway?
Even if they come in against medical advice, you still record those days.
Oh, wow.
The point is to document the potential lost time based on the doctor's recommendation.
Gotcha.
Now, always encourage your employees to follow their doctor's advice, of course.
Right. Of course.
Yeah.
So it's about capturing that potential impact.
Yes.
Even if they try and, tough it out.
Right.
What about restricted work? How do we know, for sure, when someone's job duties are restricted enough to, trigger a recordable incident?
A good rule of thumb is to consider whether the employee can perform all of their normal job tasks, at least the ones they do weekly, and work their full, regularly scheduled shift. If the answer to either of those is no, because of the injury or illness, you're likely looking at restricted work.
So if a construction worker can't lift heavy objects after a back injury,
Right.
or an office worker needs frequent breaks due to carpal tunnel syndrome,
Exactly.
those would both be considered restricted work.
Exactly. Those are great examples. It doesn't have to be, a complete inability to work. Even limitations on specific tasks or a need for modified hours can trigger the need for recording.
That clarifies things. But what about those vague doctor's notes that just say light duty, no specifics? How do we handle those?
Vague doctor's notes are definitely a pain point for safety professionals. If you encounter one, the best course of action is to reach out to the doctor and try to clarify the recommended limitations. Ask, what light duty means in this specific case.
Right.
Can the employee still perform all their regular tasks? Can they work a full shift? The more information you have, the better you'll be able to determine if restricted work is necessary.
And what if, even after reaching out, you still can't get any clarification from the doctor?
If you've made a good faith effort to get specifics and you're still unsure, it's best to err on the side of caution and record it as restricted work. It's always better to over-record than under-record when it comes to safety data.
Makes sense. Better safe than... All right.
Yeah.
Okay, so we've talked about, deaths, days away from work, and restricted work.
Right.
Let's move on to another potentially tricky area.
Okay.
Medical treatment beyond first aid. I think, most people have a general idea of what first aid is, but what does OSHA specifically consider to fall outside of that category?
Well, OSHA provides a very detailed list of what constitutes first aid. Think of it as like basic on-the-spot care that someone without advanced medical training can provide.
Okay.
So cleaning and bandaging minor wounds, using non-prescription meds at non-prescription strength.
Okay, so like, Tylenol or something like that.
Exactly. Applying hot or cold therapy, even giving a tetanus shot. All of that falls under first aid.
So even if like a doctor gives those treatments.
That's right. It's the treatment itself that matters, not who provides it.
Okay, that's important to remember. So what are some examples of treatments that would be considered, beyond first aid?
Okay.
And therefore make an incident recordable?
Anything that goes beyond those, those basic first aid measures
Right.
would likely be considered medical treatment.
Okay.
For example, if a wound requires stitches, staples, or, something more than just a butterfly bandage to close it up.
That's medical treatment.
Okay.
Prescription medications, even for like seemingly minor issues, also fall into this category. And while massages are generally considered first aid, things like physical therapy or chiropractic adjustments are considered medical treatment.
Interesting. So a simple bandage is fine,
Yeah,
but stitches mean it needs to be recorded.
that's right.
I noticed in those OSHA materials you mentioned that even drilling a fingernail or a toenail to relieve pressure is considered first aid.
Yeah.
But draining a blister is not.
Right.
Any idea why there's a difference there?
Well, those seemingly small distinctions often highlight OSHA's focus on potential complications.
Okay.
So drilling a nail is a straightforward procedure with a low risk of infection, right?
Yeah.
But draining a blister, if not done properly, could introduce bacteria and lead to a more serious issue.
Yeah, makes sense.
It all comes back to, risk assessment, even at that granular level.
It's amazing how much thought goes into like those OSHA definitions.
Yeah. So to recap, if it goes beyond those basic first aid measures outlined by OSHA,
Right.
we're looking at a recordable incident.
Most likely, yes.
What happens if a doctor recommends medical treatment, but the employee, like for whatever reason, decides not to go through with it? Do we still have to record it?
That's a great question. And it's similar to the situation we discussed with days away.
Okay.
Even if the employee doesn't actually receive the recommended medical treatment, the recommendation itself makes the injury or illness recordable.
Oh, wow. Okay.
You document the recommendation and, as always, encourage the employee to follow medical advice.
Right.
But ultimately, it's the recommendation that triggers the recording requirement.
Got it. So we've covered deaths, days away from work, restricted work,
Yep,
and medical treatment beyond first aid.
that's right.
We also talked about how certain injuries like fractures are always significant and recordable.
Yes, right.
But what about other diagnoses?
Oh, yeah.
How do we know when to record those if they don't fall into one of those like clear-cut categories?
In those cases, it comes down to the professional judgment of the physician or licensed healthcare professional. They're the ones who determine whether a diagnosis is significant enough to warrant recording, even if it doesn't immediately result in lost time or restricted duties.
So we're relying on the doctor's expertise to kind of flag those less obvious cases.
Exactly. And this really highlights the importance of clear communication between, safety professionals and healthcare providers. Building a strong relationship with occupational health providers is key. They need to understand the recording criteria and how their input helps us capture accurate data.
You mentioned loss of consciousness as a recording criterion earlier.
Yes.
Does that mean like every instance of fainting or passing out on the job needs to be recorded?
Yes. Any work-related incident that results in an employee losing consciousness needs to be recorded regardless of how long it lasts. Even a brief loss of consciousness, even for a few seconds, is considered significant enough to be documented on the OSHA 300 log.
So we're talking like full blackout.
Yeah.
Not just someone, feeling lightheaded or something like that.
Correct. We're talking about a complete loss of consciousness.
Gotcha.
However brief.
Right.
It indicates something, significant happened.
Okay.
That OSHA wants to track.
That makes sense.
Yeah.
Now let's go back to those significant injuries and illnesses diagnosed by a physician.
Okay.
We already know that conditions like fractures and cancer are always considered significant.
Right.
But what about other diagnoses that might not be like as clear cut?
Okay.
What helps determine whether those should be recorded?
This is another area where open communication with healthcare providers is crucial. The physician's judgment plays a key role here. They consider the severity of the condition, the potential for long-term effects, and the likelihood that it'll require further treatment or work restrictions down the line.
So if a worker sees a doctor for like persistent back pain
Yeah.
and receives a diagnosis of a strain, that might not necessarily be recordable right away.
That's a good example. A simple muscle strain might not meet the recording criteria initially, especially if no time off or restricted duty is recommended.
Right.
But, if that strain turns out to be more serious, perhaps requiring ongoing physical therapy or, leading to chronic pain, it could become recordable later on.
So it's not always a black and white decision at the time of diagnosis.
Exactly.
That we might need to kind of monitor the situation and potentially update our records as we get more information.
Precisely. Record keeping is an ongoing process, not a one-time event. We need to stay informed and be ready to adjust as new information comes to light.
This deep dive is really highlighting how important it is for safety professionals to be on top of these rules. I'm sure our listeners are already thinking about cases at their own workplace and wondering if they've been handling things correctly.
You're absolutely right. These criteria, while seemingly straightforward, have a lot of nuances. It's not just about, checking boxes.
Right.
It's about understanding the spirit of the rules and applying them in a way that ensures we're accurately capturing safety data.
And ultimately, it's about, creating a safer workplace, right?
Yeah.
It's not just about compliance.
Exactly.
It's about using this data to spot trends, prevent future incidents, and make sure everyone goes home safely every day.
Couldn't have said it better myself. Accurate record keeping is fundamental to any effective safety program.
Well said. Are there any other common misconceptions or tricky scenarios related to the general recording criteria that we should cover?
One area that often causes confusion is the distinction between work-relatedness and whether an incident is recordable.
Oh.
Just because something happens at work doesn't automatically mean it needs to be, logged on the OSHA 300.
That's a great point. Can you elaborate on that a bit? I think a lot of safety professionals, struggle with that distinction.
Absolutely. For an injury or illness to be recordable, it has to be work-related, meaning it was caused by events or exposures in the work environment.
Right.
So if someone sprains their ankle, playing basketball during their lunch break, that's not work-related, even if it happens on company property.
Wait.
On the flip side, even a minor injury, like a small cut that needs one stitch, still needs to be recorded if it meets those general recording criteria and is connected to the work environment.
So it's not just about the severity of the injury.
Right.
Both the criteria and the connection to work have to be there.
Exactly. Both elements must be present for an injury or illness to be recordable.
That's a really important point. I think a lot of employers kind of misunderstand that. Any other common pitfalls we should be aware of?
Another tricky area is pre-existing conditions.
Okay.
Some employers mistakenly believe that if an employee has a pre-existing condition like arthritis or a previous back injury, then any aggravation of that condition at work isn't recordable.
Oh, okay.
But that's not always the case.
So if someone with a history of back problems hurts their back lifting a heavy box at work, we can't just automatically assume it's not recordable just because of the pre-existing condition.
Correct. If the work environment or the tasks the employee performs, as part of their job, contribute to the aggravation of a pre-existing condition, then it's still considered work-related and could be recordable, depending on the circumstances and how it aligns with, those general recording criteria.
Yeah. It seems like there's a lot of nuance when it comes to those pre-existing conditions.
Yeah, absolutely.
You really need to carefully evaluate each case, even if an employee has a relevant pre-existing condition.
Absolutely. Don't jump to conclusions. Gather all the information, talk to the employee and their doctor, and then, make a determination based on the evidence and OSHA's guidelines.
This has been incredibly helpful. It feels like we've really dug deep into some of the hidden complexities that safety professionals need to know about. Do you have any final words of wisdom before we wrap up?
Remember that OSHA provides a ton of resources to help employers understand and comply with these record-keeping rules. Don't hesitate to, contact OSHA directly with any questions, or if you need clarification on a specific situation, they're there to support you.
That's great advice. And for you listening, I'm sure this deep dive has given you plenty to think about.
Yeah.
How does your organization handle those tricky situations like pre-existing conditions or vague doctor's notes? Are you confident you're you're handling things correctly
Right.
and capturing all the cases that should be recorded.
Yeah, it's all about using this knowledge to create a safer, healthier work environment for everyone.
Well said. Accurate record keeping is a powerful tool for driving, real safety improvements. Until next time, stay safe, keep learning, and thanks for taking this deep dive with us.